Medical marijuana. The American Medical Association wants the federal government to reconsider its stance on marijuana. It's encouraging more studies of the use of the drug for medical purposes. Senior medical correspondent Elizabeth Cohen has been following the story and has the details for us now. Good morning to you, Elizabeth. Exactly what do they want to change here?
What they want to change, Heidi, is some of the rules about marijuana. The federal government says that marijuana is so dangerous that it needs to be a Schedule I drug. Let's take a look at what it means to be a Schedule I drug. The feds have lumped marijuana in with heroin, cocaine, ecstasy, a drug called trip, and LSD as drugs that are so unsafe that they shouldn't even be used under a doctor's supervision. And what the American Medical Association is saying, look, marijuana can have medical uses. We think it possibly could be safe under a doctor's supervision. And so they want the federal government to consider moving it out of that category. That would make it more easier to access the marijuana so it could be studied more.
Okay, so what does the government have to say about all of this?
The government has really been quite clear about this. They have said, look, we think marijuana is highly addictable. We think that it can cause terrible problems like cancer and other issues. And also, they say, the federal government has said, even if it does have medical benefits, there are alternatives. You don't have to use marijuana to get these benefits. So I think they're going to have a hard time convincing the feds of this.
What about studies, though, that show some of these medical benefits of medical marijuana? Been verified, not verified? I mean, what are we really talking about?
I think it depends who you asked. I mean, I think some people will say, oh, these studies don't really show what they say they show, and others say that they really do. The studies have pointed to several different things. Two of the big ones are increasing appetite. There are, for example, cancer patients who lose weight because of the cancer or because of the drugs, and they say that the marijuana helps increase their appetite. And other patients who were in pain say that marijuana helps decrease the pain. Again, in the eye of the beholder. I know some people who would say, well, even if it does that, there are alternatives. You don't have to smoke pot to increase your appetite.
Yeah, absolutely. All right, still a discussion being had, obviously. Elizabeth Cohen, our senior medical correspondent. Thanks, Elizabeth.
Thanks.